Did you know that in a recent issue of the prestigious New England Journal of Medicine, the editor advised medical doctors to begin including nutrition in their therapies or be left behind?
The rising cost of healthcare insurance will force more and more small businesses to fail.
Did you know that Mutual of Omaha has begun offering reduced rates for people using modern nutritional preventive techniques and supplements? If insurance companies are offering reduced rates, you know it works.
As the knowledge of the efficacy of these preventive techniques reaches more and more of America, our health and vitality will begin to return. We will become a healthier nation, and our new productiveness will stimulate our gross national product to increase. Instead of being an ailing nation, overridden with degenerative disease, we have the opportunity of becoming a strong, vibrant nation again.
We must embrace a healthcare system that promises us a chance at improved national health. We cannot be satisfied suppressing the symptoms of illness with drugs. According to an article in that same issue of the New England Journal of Medicine, the cost of alternative health care is 1/60th that of the mainstream medical approach.
So we're looking at a blossoming healthcare system that can reduce our national economic burden. And although there has been a strong history of high increases of the cost of drugs, by keeping the entrepreneur in the marketplace, Congress will force the drug and pharmaceutical industry to lower their prices to compete.
The question here is, will Congress give the entrepreneurs who started this new industry the right to fight for a spot in the healthcare marketplace? Or will Congress allow corporate America to once again swallow up the entrepreneurial spirit that is the backbone of our country? True, we need corporate America for economy and stability, but the entrepreneurial spirit doesn't need to be crushed in the process.
But the body of the nation cannot live without the spirit, and if we allow the entrepreneurs to disappear along with the future of our folk remedies and traditions, so too will America.
But if Congress continues to support its 200 years of belief in the strength and spirit of its citizens, then it will be moving to give adventurous America a means to fight its way back to superior national health by allowing the entrepreneurs to survive its traditions of home care and folk remedies to feed America's future, and its moms to continue to care for their families using the traditions of the past and building the traditions of tomorrow.
And remember, the FDA's own record of predicting safety falls far short of acceptable. I remind you that the FDA's position is that unless the number of deaths from the drug, and I quote, exceeds what is normally expected or predictable, the drug products are typically left on the shelves. There is something terribly wrong here. The number of deaths for prescription drugs may not exceed what the FDA expects, but it exceeds what every American must find atrocious. I remind you again that according to the estimates from Johns Hopkins University, the New Jersey College of Medicine, and the Association of Poison Control Centers, between 80,000 and 120,000 Americans die every year from side effects of prescription drugs. Almost as many Americans die from doctor-prescribed drugs every year as died in combat in both the Vietnam and Korean Wars.